conversation. I really appreciate. All right. You may want to ask, who is Alex? And why should you even listen to me? Why should you even care? Why should you even bother to listen to whatever I am going to say in this webinar? I know some of you might have been asking, well, if you have not asked, it's fine. But if you do, I would like to let you know that I am a registered nurse at the foremost University of Benin. I am registered with the Board of Nursing and Midwifery Council of Nigeria, and I have practiced on the bedside, and I have also worked in the health insurance space. And it is the knowledge that I have gathered in these two environment, that is how I came about this topic, because I realized in the course of my career that many people who claim health insurance does not work, it's not really because it does not work. It is because some of them, or rather majority of them, they lack the necessary information to ask the right question. They lack the necessary information to make them make informed decision about their plans, informed decision HMO to use, informed decision about which plan to buy. These are some of the discrepancy and disconnect that makes people come out and say HMO does not work. Let me be clear, please. HMO works. And I repeat, HMO works. But the experience you get depends on some of the things that I'll be sharing in this webinar. All right. So whether you already have a health plan or you are just hearing about HMO for the first time, this session will open your eyes to how the system really works and how to make it work for you. Yes, how to make it work for you. It is when it works for you, that is when you have a good experience. If it does not work for you, you will now be among those that are shouting that HMO does not work. HMO really works. So before we get into the deal of today's conversation, I'd like to start from the basics just to ensure that those of us that have not heard about health insurance before are fully carried around. This session will be in three phases. The first phase is that I will talk about health insurance, how to go about it, and what it's all about. The second phase will now dive into the conversation, which is what? The good, the bad, and the ugly. Then I will now take your questions accordingly. That is how we are going to do it. So if you have questions, just put it in the comment section and I will respond accordingly. And immediately, trust me, I will ensure that I go back to all questions raised in this webinar, act on them as requested. All right, let's dive in to today's conversation. You may want to ask, what is health insurance? This is one question that many people have been asking. Some have not even heard about what health insurance is. You understand? So, by definition, let's just start simple. Health insurance is an agreement between you and an insurance provider, usually called an HMO. So, if you do not know, HMO means Health Maintenance Organization. Health Maintenance Organization. Now, what happens? You whether pay a certain amount. For some, it could be monthly. For some, it could be biannually. Some, it could be quarterly. And in return, they help you pay for your hospital bills when you need medical care. Trust me, this is like a life-saving financial shield for your health. You will not understand. I know some of you might have gone to the hospital and you will see some people, they come to the hospital, they will see doctor, and they will not pay any money. They will do tests. And some people will be wondering, is this one VIP? No, it's not any VIP. Oh. There's no VIP inside. Although there might also be VIP plans. But basically, what health insurance does is that it gives you this peace of mind because nobody plans to be ill, to be honest. Nobody plans to be sick. Nobody plans to have a medical emergency. That is the main function of health insurance. So let's say, for example, a member of your family falls ill. So Instead of looking for your ATM card to go and withdraw money, you simply just go with your health insurance card. As you can see on the screen, when you get to the health insurance, when you get to the hospital, you just present your card and you'll be allowed to see doctor. Life is not hard, it's very sweet. Imagine, for example, 2 a.m. in the night, you have a medical emergency and they are to rush you to your hospital. Is it that time that you will not be going to the bank to go and withdraw? Of course, even if you have the money, at that odd hour, see money to have close. Even if you have money, what if you now go to the ATM and ATM is not working? You'll be stranded. So basically, health insurance is to lift that burden of having to pay out of our pocket for treatment that have been rendered to you in the hospital. So in summary, health insurance is just like, for those of us that know what I want to say now, you hear something like Olidara or Ajo. It's like a savings you contribute into a risk pool that when you now decide to go to the hospital to go and see doctor, you don't have to bring money to pay. You don't have to pay from your pocket. You will just present either your card or your enrollee number, whatever being the case. And once the hospital confirms that you are active on the HM, they will attend to you. You see doctor, you collect your drugs, and then you go home. That is the summary and basic description of what health insurance is all about. So now let's look at the types of health insurance that we currently have existing in Nigeria. Basically, there are three main types you should know. One is the government sponsored health insurance, popularly referred to as the NHIA, National Health Insurance Authority, formerly NHIS. It was created to make healthcare affordable to every Nigerian, especially civil servants and people in the formal sector. All right. Although they have now also extended to other parts. You understand? They have also extended to other parts. All right. Which is, the formal sector is those that are working in government parastatals. We also have the informal sector program too, which is for traders, artisans, and self-employed people. For the NHIS, there's also a third group which is for the vulnerable group fund. This one is for people who cannot maybe pay for the health insurance, and then there's a way to go about it when you visit the NHIA website. So if you want to know more about NHIA or NHIA health insurance, all you need to do is to visit their website. All right, and you can get enough information as you would desire. All right, now let's look at the second one again. This second one is the private health insurance. This one is the most common. This one is what people hear every time. You see them advertising online, they have marketers moving from place to place. And one thing that is common to this one is that you either see them, they sell different packages. Even with the NHIA too, there are also packages. All right. But the reason why private health insurance is very common because they are so plenty. All right. There are plenty with different names, and then they come with different plans, they come with different packages. All right. Now let's look at the third group of health insurance. This one is the state-owned health insurance. Remember, the first one I mentioned is the what? Federal government owned health insurance. That one is owned by federal government. Okay, run by federal government. The whole idea is to provide health insurance to all Nigerians. And for your information, it is now mandatory that as a Nigerian, you are supposed to be registered under a health insurance plan. And the state-owned health insurance is to further deepen the penetration of healthcare access. Understand? As part of the NHIS guidelines. Okay, so this type is operated by various states. What that means is that If you are in Lagos, Lagos State will have their own health insurance. If you are in Benin City will have their own health insurance. So that's how it is. But basically, all of them are operated by the state government, although they are all regulated by the NHIA. So NHIA is the regulatory body that coordinates the affairs of health insurance in Nigeria. All right. If you have any question, put it in the comment section. I'll be well available to answer accordingly. Now, you may want to ask, what is that now one thing that is common to all HMOs? Yes, so whether it is government owned, whether it is the federal government owned, whether it is state government owned, or even whether it is the private health insurance, they all have one thing in common. And I guess what is in your mind is what I'm thinking. As you can see, now here is something many people don't realize. All HMO, they have one thing in common, and that is what? They don't cover everything. Yes, they don't cover everything. No matter how premium or expensive your plan is, every HMO plan has its limitations and exclusions. Don't worry, we'll explain further as we dive deeper into today's sessions. Yes, no matter how premium it is, no matter how VIP, there's always limits, there's always exclusion. What that means is that there are some things that are not covered. In some plans, there's a certain amount that you get to it will finish. In some plans, there are some hospitals you cannot use. In some plans, there are some diseases they cannot treat. For instance, you cannot use HMO, for instance, to go and do BBL. You cannot use HMO, for instance, depending on the plan, to go and do facial reconstruction surgery. All right. You cannot use HMO to go and do transplant. Why it may be covered in a plan, it may not be covered in another plan. So limit is saying that, let's say your plan is 20 naira, for example. This is just an hypothetical figure. If the total sum covered in your plan, let's say for a year, is 20 naira, what limit is saying is that by the time your hospital submit bills up to 20 naira, the next time you go to the hospital, you will not be able to see doctor. You will not be able to access care. What that means is that you have reached your limit. Sometimes you can also see it for surgeries. Let us take, let's say, cesarean section, for instance. If in your plan, the limit is, for example, 450,000, it means that if your hospital submits a bill of 600,000 or 500,000, your HMO can only pay for that 450,000 that is in your plan, and you may have to pay the difference out of pocket. You may want to say, "Hi, it's still better. Paying 50,000 out of your pocket, is it not better than paying the whole 500,000 from your pocket?" Yes, so that's the peace of mind. That is the comfort that HMO brings to healthcare access and utilization. All right, let's move on. For exclusions is saying that there's some procedures that your HMO may not cover. There are some things that your HMO will not want to pay for, and those services are called exclusions. Sometimes it could be that they can also cover it, but in the package that you bought, it is not part of it. Let's say, for example, you must have heard some plan silver and gold. In the bronze plan, for instance, it covers 20 days of admission. In that same bronze plan, it's major surgery. So exclusion is now saying that the HMO will not pay for that process. Usually there's okay. This is that once you're onboarded to an HMO, they confirm if once they confirm that you're active, after seeing the doctor, the hospital will send a request to your HMO. We call it pre-authorization request. Once this is sent, before your HMO respond, we confirm service that your hospital is sending is in your plan. If it is in your plan, but if it will not be approved. All right. Do well to let me know in the comment section. All right. One. Another um, we ask that is common to all HMOs. It is not enough to say I have. The real question is, do you know what it truly covers and what it does not? Because you see, once you understand this principle, you will avoid about 90% of the that people usually experience when it comes to the utilization of their health insurance. Okay. Once you know that service is covered, when you are going to the hospital, you'll be prepared. You will not be worried because you already know that some services are not covered on your plan. But because most people don't know, they erroneously assume that the HMO covers everything. Just like I mentioned in the previous slide, HMO does not cover everything. There are exclusions, limits, and because of these two parameters, it is possible that the hospital can send a bill that you may need to pay. You understand? So once you have this knowledge, you are good to go. Once you have this knowledge, you will not feel bad. Because from my experience, when I was working in environment before I now transition to the health insurance space, many people don't even know their plan. They don't even know what for. And you must have heard this saying that ignorance of the law is not an excuse. So just because you did not know what is in your that is covered does not mean that you will now be excluded. No, you have to know. And that is why we are here. All right. Okay. Let you register for an HMO. How do you now register for an HMO? How do you register? That's one question that you may want to ask. How do you register for an HMO? There are three ways to register for an HMO. Number one is personally. Number two, through an employer. And three, through an agent. Now, let me take one by one. Personally means that if me, for instance, I'm not working in the government sector, I am on my own and I want to use HMO. It means that I can just go to the HMO website and buy. And once I buy, I'll pick a plan that I want. And what happens? I'm registered. Nowadays, it is usually automated, which means you can visit a health insurance organization, for instance, online, buy a plan, and you are good to go. The next day, you can access care. In some of them, even that same day too, you can access care. You understand? So what that means is that you go online or you go to that physical location, depending on where you're located, make inquiries, ask about what you need, ask the right questions, and they will answer you. So if you are married, for instance, that means you may need to go for a family plan. If you are single, you can buy an individual plan. Do you understand what I'm trying to say? Okay, so for personal way to get that insurance is that you yourself, you can buy insurance for yourself. Yes, you can buy insurance for yourself. That is what personal is talking about. The second one is through an employer. Now, this one is for people that are working. What it means is that because it's mandatory and it's a regulated space, if I am working in an organization, for instance, my employer is obliged to purchase health insurance for me. In some companies, it can cover you and your family. In some other company, it covers only the person that is working in the organization. So what happens next depends on the company policy. So if it covers you and your family, sometimes there may also be limits. They can say father and two biological children, family of four. You get it like family of two, family of four, family of six. For family of six is father, mother, and what? Four biological children. For family of four, it is father, mother, and two biological children. So what is covered and what is paid for depends on the organization you are working for. Another way that people get health insurance or another way that people get access to health insurance is through an agent or marketer. Now, the agent can either be a broker that is affiliated to an HMO or a marketer that is affiliated to an HMO. So what that means is that let's say I am working for an HMO and I'll come and meet you, say, Madam, good afternoon, or Sir, good afternoon, or good evening. My name is Alex and I work for a HMO. All right. And then I will not give you my plans or our plans for you to select. Usually, what the agent does is that they lecture you or give you a brief sales or what I would call presentation of what the plans look like and try to convince you to pick a particular plan based on their own assessment of your needs. So at that point, you may have to discuss with the agent or marketer what you need and the price for each plan you can now select. This one is usually easier because when an agent is involved, they help you with what we call onboarding. Onboarding is after you bought the HMO plan, there are some paperwork that they will now do for you. They will now select the hospital that you will now attend. In some HMO, they allow you to roam. What that means is that you can use any hospital that is partnered with the HMO. In some HMOs, you are allowed to use specific hospitals. That means you're not allowed to roam. For instance, let's say I live in Lagos, for instance, I can only use a hospital in Lagos. But if I travel to, let's say, Port Harcourt or Abuja, I may not be able to use a hospital. Now, that means that that one does not allow me to roam. A roaming plan means that you can go to anywhere in Nigeria or even abroad. Yes, some HMOs have abroad coverage, which means even if you travel to the UK, for instance, you can also access care with their HMO card. Now, the difference between this one is the price. Of course, we do not expect the amount for the HMO that sponsors abroad treatment to be the same price with the one that covers only Nigerian or local treatment. So that is where the HMO plans comes in. For some, they have different nomenclature. You can see bronze, you can see silver, you can see gold, you can see platinum. In some HMO, you hear say VIP, you hear black card. They have different names. But irrespective of the plan or the name of the plan, the thing that is common to these plans is that they have different benefit package. You may want to ask, what is a benefit package? A benefit package is the benefits you are entitled to when you buy an HMO. What that means is that when you go to the hospital, there are some things that you can do. There are some things that you cannot do. There are some treatments that you can enjoy, and there are some treatments that you cannot enjoy. In plan A service can be covered. In plan B, that same service may not be covered. For some plans, in plan A, you can use highbrow hospital or what we call VIP hospitals. In plan B, you may not be able to use this hospital. While in plan C, you can use any hospital in your area. Did you get that? So what I'm trying to say is that the difference between each of these packages is a function of their benefits. It is the benefit that separates these plans. It is the benefits that make them different. And of course, they do not have the same price. All right. Now, let's dive into the benefits of using an HMO. Of course, having a HMO or having an HMO is one of the best things you can ever think of. Yes, like I mentioned, in the introductory class, it is so good. You can't downplay the importance of having health insurance. You cannot. You cannot. Even if you have money in your pocket, even if you are very rich, because medical emergencies, they don't blow siren. You can agree with me with that. They don't blow siren. They don't make announcements. Somebody can just wake up now feeling okay, and the next moment they are very ill. It's not that time you will now be looking for your ATM. What if it happens when you are not close to your ATM? You will now be stranded. What if it happens where you are not close to your house or you are not close to your domiciliary residence? It becomes an issue. So here are 7 benefits of having an HMO. It is a must. Number 1 is financial protection. So we may want to ask, what is financial protection? It means that at every point in time, at every point in time, you know that if you fall sick, or if you are married and anybody in your household falls ill, you can comfortably carry them to a nearby hospital without paying 1 naira. In some case, you might need to pay a fraction. I forgot to mention that when I was talking about the NHIA. Yes, they have co-payment. Sometimes some plan have co-payment. Co-payment is that if the amount of bill that the hospital is giving you is, let's say, 20,000 naira, co-payment means that you may have to pay 2,000 naira out of that 20,000, while the HMO pays the remaining 18,000 naira. So that's co-payment. In some, you don't have to pay anything. All you need to do is to present your HMO ID card or your HMO policy number, and that's all. You can access care, you can do any treatment, you can do any test, you can see any doctor as prescribed by the what? Doctor on call, or as prescribed by your hospital. All right. Another benefit of having health insurance is access to quality healthcare. Yes, access to quality healthcare. This means that depending on the plan that you are buying, depending on the plan that you are buying, there are some hospitals that on a very good day, if you go there, they can tell you to drop 50,000 deposit because they are very big. This is also connected to the financial protection. 50,000 deposit. In some hospitals that are not quite equipped, they will say maybe 10,000. Now, it means that if you have health insurance, depending on your plan, you can go to any hospital. You can see a specialist without that fear of, I'm going to pay more, I'm going to pay more, I'm going to pay this, I'm going to pay that. You're not afraid. You can see the best doctors in that hospital without any fear, without any iota of fear in your mind. That is because you have health insurance. Unlike if you were a private patient that you want to go to the hospital, many people in our environment, this is the reason why they don't go to the hospital. They first of all go to chemists. Of course, it is cheaper but more dangerous. Do you understand? So, because in chemists, for instance, you just go and say, I want to buy paracetamol, and the pharmacist will give you paracetamol, and they give you, and you pay and you go home. There's no consultation, and there's no pay deposit, there's no I want to do test, there's no anything. Just collect your drugs and go. But in the long run, that is a typical definition of penny wise pounds flesh. And because there's something that is occurring underneath that you probably may not know. You understand? There's something happening. So because of that fear of paying for deposit, doing tests that you don't want, and because of the money involved, many people prefer to pass through the backyard. So first of all, go and even drink agbo first. Yes, you go and drink agbo, it's cheaper. But if you have health insurance, you will not be worried. Anytime illness struck, you can comfortably walk to the hospital and see the doctor. Yes, so it means per time, per unit time, you get quality access. You get seen by a qualified medical personnel, not by a quack. Another benefit is preventive care. What is preventive care? Preventive care is simply, as the name implies, You are preventing something from happening in the future. What that means is that you can go to the hospital, run some basic pre-medical checks. We call it screening. So in screening, you can check yourself. And to be clear, it is not only when you are sick that's when you should go to the hospital. No. But if you do not have HMO, you won't want to just go to the hospital and say, doctor, check me. Or nurse, please, I want to check on my whole body. Most people will not do that. Particularly in our kind of environment. Most people, it is only when they are very sick, that is when they go to the hospital. But when you have health insurance, you know that you can do pre-medical tests, pre-medical health screening to check your sugar level, they'll check your blood pressure, they can check your plasma lipid profile, they can even check your hormonal profile. They can check, do complete body examination, full body examination. We call it head to toe examination to check your head, to check your eyes, to check all parts of your body to know if there's a disease, to know if there's something wrong with your internal system. And that is why they say prevention is better than cure. Any condition you detect early, if you detect that condition, for instance, let me give you an example. Let's say I went to the hospital to go and check myself, and I did not know that my sugar level is going up. If I do not have HMO, I may not want to go to the hospital to go and check my sugar level. I'll be there until bad thing will not happen. But when you have health insurance, you can go and check. I'm not saying that even as private patients, you cannot go and do preventive care, but you self, you know that in our kind of environment, most people do not go to the hospital when they are okay. Majority of people go to the hospital when they are sick. And that is when, after the hospital have run some investigations, they will not detect one thing. It's not supposed to be like that. So when you have health insurance, trust me, you can do all these tests without worrying, without getting scared. And that leads on to the next benefit, which is cashless treatment. Cashless, as the name implies, cashless, which means you can walk into any hospital without going with your wallet. Anyway, that has the clause. That is if you are using the right HMO. That is if you are using the right plan. Because if you have the wrong plan, or you have a plan that does not really cover you, if you go there, they might tell you to pay money out of pocket, even when you have HMO. So this is where, or this is why it's good to critically analyze the HMO plan before you buy. It's not all about having HMO. You have to have an HMO plan that gives you peace of mind, not the one that you go to the hospital, you'll be worried that will they cover this? Will they cover that? That one is not that peace of mind. In fact, you are now having more wahala. You are now more agitated. It's no longer peace of mind. All right? Yes, it's not. So that takes us to peace of mind. Peace of mind peace of mind is plain English. Peace of mind is you're not worried, you're not disturbed. You just know that your HMO got you. You just know that your HMO they got you. Okay? You just know that no matter what happens, you are covered. All right. That cannot be overemphasized. You know what peace, you know what it means to have peace. Know that you'll be sleeping, you'll be thinking about your hospital bill. But with HMO, even when you wake up from sleep, you want to go and see a doctor, you can do that. Nowadays, some even have telemedicine plan, which means you can consult a doctor from the comfort of your home, even without leaving your house. And you can talk to the doctor on phone, and whatever drugs that are prescribed will be sent to you to your house. So gone are the days where you must leave your house before you see a doctor. Nowadays, you don't need to even leave your house unless it's a medical emergency. You don't need to leave your house to see a doctor. You don't. And that is one of the benefits of having an HMO. Another benefit is affordable premiums. Yes, a premium is simply the amount you pay to get your health insurance plan. Like I mentioned in the introduction, it can either be what? Monthly, it can be biannually, it can be quarterly, it can be yearly. It is that amount that gives you access to that health insurance plan. It is that amount that gives you access to the HMO when you get to the hospital. It is after you have paid that amount, you can comfortably say, I am a member of so 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 and so HMO, and I can use hospital A, hospital B, and hospital C without being worried. You understand? So premium differs based on plans. Do you get that? So premium differs depending on the plan. So plan A premium can be 100,000 per year. Plan B premium can be 20,000 per year. Plan C premium can be 400,000 per year. And don't get it twisted, each plan has its own benefits. Sometimes it's not by the plan, it's not by because it's expensive, so you will get good care. So there are some things you must check, there are some things you must ask, there are some things you must look out for before buying a plan, so that you don't just go and buy a plan and the plan does not deliver as promised. And that is why we are in this webinar today. If you are enjoying what I am currently discussing or what I've discussed so far, do well to say what you have learned so far. Do well to drop a comment in the comment section. Just share your thoughts and I will respond accordingly. And now the last benefit of health insurance is what? It encourages a healthy lifestyle. It encourages a healthier lifestyle. What this means is that at any point in time, you can comfortably go to the hospital. Most people don't go to the hospital because it is expensive. Trust me, healthcare is very expensive. Healthcare is very expensive. It's very expensive. So most people don't want to go. Most people don't want to spend money. So because they don't want to spend money, they can now prefer or they will now prefer to go to the chemist. They will now prefer to take some other products because the fee is cheaper, because they cannot afford it. You understand? But if you have health insurance, you will always go to the hospital on time because you know you're not paying out of your pocket. But the person that is going to pay out of the pocket, they will not want to go all the time. They'll say, you kind of sickness is this one. But when you have HMO, it helps you live a healthy lifestyle, which means you will not be scared to go to the hospital, which means you will not be scared to go and receive or access quality medical services. All right. So these are some of the benefits of using health insurance. Now, these benefits differ from HMO to HMO. Some HMO is frustration. Some HMO is like heaven on earth. Like I mentioned, that health insurance is like marriage. If you marry right, trust me, it's like heaven on earth. If you now marry wrong, my brother, you know the story, you are finished. It is the same experience you can also get when you choose either the wrong HMO or the right HMO. You may want to ask, which one is the right HMO? Which one is the wrong HMO? Stay put to the end of this program, stay put to the end of this webinar, and I'm going to explain accordingly. All right? Now let's go into the cocoa of today's discussion, the good, the bad, and of course, the ugly. Yes, your experience falls under these three broad category. It can either be good, it can either be bad, or it can be very frustrating, it can be very ugly. Okay? And the experience you get depends on the HMO you choose. Okay, let's dive in. So, what is the good part? The good part is what health insurance should be. These are the good part. And this summarily is embodied in some of the benefits that I have explained in the previous session. All right, at its best, health insurance is supposed to be a lifesaver. Yes, last when he said that you shouldn't be worried. Trust me, if your health insurance makes you worried, that one is not an health insurance. If your health insurance is making you have heart attack, that one is not health insurance. At least you should have there's this confidence you should have. I have HMO. Yes. You should carry it with pride. So if you cannot carry your HMO with pride, my brother, it means that you are probably using either the wrong plan or the wrong HMO. All right? It is that feeling of peace when you walk into a hospital knowing that your bills are taken care of. Yes, you will understand. It's very sweet. You don't have to worry about the amount. In fact, the amount is not your business. Your one is to see a doctor and you walk in and walk out comfortably like a king. That is the good experience of using HMO. In summary, a good plan gives you access to what? Quality healthcare when you need it. It gives you access to what? Reliable hospitals and doctors, not quack hospitals, not quack doctors. A good experience means that you have access to the best hospitals, to a qualified doctor, to a qualified medical practitioner when the need arise. Another good experience is that timely approval without unnecessary stress. Now let me explain this one. What is an approval? I have mentioned this before. An approval is simply the request that your hospital sends to you. Sorry, that the hospital sends to your HMO when you want to receive a medical service. Let's say, for instance, you go to the hospital and they say they want to do a scan. Let's say they want to do an abdominal scan. Now, the hospital will send a mail or put a call across to your HMO, and your HMO will now approve it based on your plan benefit. In some HMO, you see that thing I just said now, it can take like 3 hours. In some HMO, it can take the whole day. Why in some HMO? It's like this. At the snap of a finger, they've responded. So what that means is that some HMO responds on time, some HMO delay response, and you see that delay. For the one that respond on time, it means you can go to the hospital and come back on time. For the one that does not respond on time, it means you can spend the whole day and not get things done. When you spend lesser time, that translates to good experience. All right. Now, when your HMO works properly, you feel protected, you feel valued, and you feel supported. This one cannot be overemphasized. You know that feeling. You just know. And I've seen people that my HMO can cover it. It's pride because they know that the HMO is reliable. They know that the HMO is dependable. They know that the HMO is trustworthy. These are the good aspects of HMO. These are the good feeling that you have. These are the experiences that makes HMO good. In fact, that is what the system is meant to do. The system is supposed to protect you from financial shock. A shock, yes. Imagine being asked to deposit 500,000 naira because of a medical emergency that will require a surgery. Coughing out 500K in this time, it will move you. You understand? But when you have the right health insurance plan and you now hear that your bill is like 600,000 and you're not paying 1 naira, you feel valued, you will feel supported, you will feel protected, and that translates to happiness. You'll be happy. You'll be very happy. Yes, you'll be very happy. And that is what health insurance system is supposed to deliver. All this cumulated translate to the good experience of having an health insurance plan. Okay, now let's go to the bad. This one is why many Nigerians waste money. Yes. This, you know what bad means? That means you're not enjoying it at all. And unfortunately, this is the experience of most Nigerians when it comes to utilizing their health insurance. And this is where the bad comes in. A lot of Nigerians waste money on health insurance plans simply because they buy plans without understanding the coverage. They focus on price, not the value. They don't match their plan to their real needs. Let's say, for example, you are in a family of five and you are buying the same plan as another family in another HMO. It does not make sense. Why? Because the other HMO might have bronze plan. Please pay very close attention. Just because two HMOs have bronze plan does not mean that the two bronze plan covers the same thing. No. Just because my friend bought a plan does not mean that I too I should buy that plan. No, it does not work like that. Because A family might have a condition they are treating. Let's say, for example, in family A, the father is hypertensive, and in family B, the father is not hypertensive. Or let's say in family B, the father is hypertensive and the mother have arthritis. While in plan B, the man does not have any condition, the woman does not have any condition. Of course, they cannot buy the same plan because in some plan, there's a limit to the coverage they can get for chronic condition. You may want to ask, what are chronic conditions? Chronic conditions are conditions or diseases that you treat for a lifetime. Number one is hypertension. Number two is diabetes. Number three, we have peptic ulcer. And sometimes we want to have things like asthma, okay, arthritis, rheumatoid arthritis. These conditions require treatment for a very long time. So you cannot go and buy the same plan with somebody that does not have BP. You will have a bad experience because you will now go to the hospital and you hear things like you're not covered, or they will say the limits have exceeded. You will feel bad that it's not covered. But is it really the HMO fault? Yes, sometimes no. It is their fault if they did not properly tell you, or if you were not properly explained to. It will be no. If you say did not ask the right question, and the question is, how can you ask the right question when you don't even know what to ask? You will not know what to ask because it is when you know what to ask, you can ask. So this is where many people get, I don't want to use the word scam, but technically speaking, that is what it is. If you do not have the knowledge to ask the right question, you will just buy a plan because it's cheap. You buy it. And when you go to the hospital, you'll not be hearing things like, it does not cover this, it does not cover that. You may have to pay small for this, you may have to pay small for that. That is what it means when I say some people buy plan that don't match their real needs. You are hypertensive, you should buy a plan that you are sure will cover your hypertension drugs. If you are diabetic, you should check to confirm that your HMO can pay for your diabetic medication. If you are an arthritic patient, you should be able to decipher whether your health insurance can cover for those medications. Let's say you are married, for instance, you should also confirm if your HMO can cover for delivery. Some can cover for delivery, some might not cover for cesarean section, what some of you call operation. You have to ask these questions. If you do not know, how can you ask? It is now when you now go to the hospital, they will now tell you that you only cover for delivery, oh, you only cover for normal delivery, you not cover for operation. You now start shouting. At that point, you feel terrible. At that point, you feel bad. You feel cheated. But it's not your fault. You were not told. It's not your fault. You didn't know. It's not your fault. If you had known, you would have asked the right question. That is why we are having this session today. So, in this webinar, please pay attention to everything we say. Please pay attention to everything I'm going to be telling you because knowing what to ask at the right time can prevent unforeseen pain, can prevent unforeseen heartache. Imagine your wife is pregnant and the hospital says because of the nature of the pregnancy it will require operation and your HMO say they will not cover and the hospital is telling you that you are going to pay 700,000 naira. At that point, you will not be happy. One, because you have HMO, and two, because you did not know that HMO does not cover. All these are just tiny examples of what translates to bad experience. Yes. Now let's go into the dangerous and the most scariest part, which is the ugly. I've mentioned some of them in the previous session. Now, what are the ugly part of HMO? I will categorize them as scams, loopholes, and false promises. Let me start with the scam. The scam part is when you are not told the right thing. You just, it's cheap, and just pay 5,000 naira and you're covered for the whole year. You self raising now. How can you buy a plan of 5,000 naira and you expect to cover everything for the whole year? You self, you're also part of the problem of this country. You sef, you're also part of the wahala of this country. Don't fall for cheap, cheap, cheap. If it promises too good to be true, it's probably not true, my brother. Loopholes can also exist. False promises can also exist. Now, here's the thing that really gets frustrating. We have some agents. They are very fantastic storytellers. Their mouth is very sweet. Okay, join our HMO. Our HMO, we cover all basic diagnostics. We cover all tests. You can use premium hospitals. You can use clinic hospitals. They sweet talk you to buy a plan. And when you now get to the hospital, you now be hearing things like, sorry, ma, your plan does not cover that. And sorry, this hospital is not your network. But the person told you that you can use any hospital. Why is it now that you are getting to the hospital and they're telling you that your HMO is not accessible here? But the person that sold it for you told you that you can use any hospital. Is that one not scam? It's scam. Or you say, we only pay up to 10,000 for that procedure. We only pay up to 10,000 of a procedure that costs 70,000, which means you have to pay the remaining 60,000. But the person that sold the plan for you told you that all procedures are covered. All procedures are covered. That's what they told you. You will feel bad. You will feel sad. So these are the ugly side of health insurance. Many people are victims of fine print and sales gimmicks. Yes, what are sales gimmicks? Sales people, they have targets to meet. They're not really interested whether you benefit or not. They just want to sell. And after they sold to you, they go. If your HMO can't clearly explain what is covered in your plan, my brother, that's a red flag. If they delay your claims approval or dodge hard questions, that is another red flag. You see, there should be transparency at all points. So when you are not getting the right answers to questions you're asking, let's say you are asking your agent or the person that is trying to sell the HMO to you, they're asking if your HMO can use a hospital in, let's use Lagos for instance. You are saying, can I visit a hospital in Victoria Island? You say yes. Or you say there's one the person is still trying or stammering to give you a response. It means that, my brother, you should beware. You should be scared. You should be worried. Okay? You should be worried. That is what it means. You see, transparency in your HMO should not be optional. It is a must because these are some of the things that cause this ugly scenario that we're talking about. False promises, loopholes, they all exist. But you need to have the lens to look at it before you can able to decode it. And that's why you need experienced people to help you ask some of these tough and hard questions. All right. So I believe that you don't want to have any ugly experience because it is this ugly experience that is making people to say health insurance does not work. Now, you may want to ask. I know you're already asking, how do you not choose the right HMO? Here's my simple formula. It's not hard. It's not that difficult. Number one, start with your need. What do you need? Assess or check yourself. What do you need? Are you single? There's a single plan. If you are married, there's a married plan, or there's a plan that caters for a family, and if you cannot buy a single plan. If you are elderly, you should look for a plan that can cater for elderly conditions. If you have a chronic medical condition like hypertension, like diabetes, like chronic arthritis or rheumatoid arthritis, or what we call peptic ulcer disease, these are conditions that may require extra care, extra medication, extra specialist investigation. If you are married and your wife wants to deliver, you also confirm if it can cover maternity. You need to know. And even if it covers, to what degree, to what extent, you have to ask. The nature of the hospital is also a criteria you must check. Check the hospital. An HMO is only as good as its part. as its partner hospital. Let me tell that again. An HMO is only as good as their partner providers. Providers are the hospitals on their network. Make sure the hospital that you like is nearby you, because if you go to a hospital that is not well equipped, it's like you don't value yourself. It's like you do not respect your health. It's like you do not regard your health. That is why you go to a hospital that does not have the right medical personnel to handle your medical condition. Okay, so check for your needs. I repeat, your needs. Are you single? Are you married? Are you elderly? Do you have elderly parents? Are you managing a chronic condition? Are you managing a chronic illness? Please check. Check the hospital list. Is it close to your house? Is it close to your office? Can I really go there anytime? Can I visit there at 2 o'clock in the night and somebody will be there to answer me? Don't just take the word of the person standing for you. You have to go to the hospital and check for yourself. Because if I'm selling an HMO plan, for instance, I'll tell you that you can use any hospital, you can use hospital abroad. I want to sell. This is the secret sauce. So you need to ask. You need to ask. You need to confirm these things before you can choose the HMO. Look at your plan type, look at what is inside the plan. Leave the money, look at it inside. Look at it inside. You need to know. It is after you have known these things, you can now comfortably say, okay, I want to choose my HMO. I want to buy plan B. I want to buy plan A. I want to buy plan C. Make sure you check your needs. Make sure you check the hospital list. Make sure you check your condition. Make sure you check your current situation, which can change per any time. Okay, let's wrap it up. I want to believe that you have benefited a lot from this conversation. And if you have stayed this far, I want to really say thank you so much for working with me. Thank you so much for staying to this point. And then just to wrap it up, health insurance is a partnership. You pay to stay protected. Note, kindly note, every HMO, they have their limits. Read before you buy. You can see how I'm dragging my ear. Read before you buy a plan. Oh. If you cannot buy a plan, ask question. Don't just choose based on price. Choose based on your needs. Ask questions. Stay informed. Demand transparency when you choose or when you want to choose. And when you choose right, health insurance is like a blessing. But when you choose wrong, my brother, health insurance can be chaotic. It can be quite frustrating, my brother. I tell you the truth. It can be quite devastating. Okay, now, if you benefited from this webinar, I don't want you to benefit alone. Please share it with your friends for them to watch and also learn what you have learned. Share it with your friends, share it with your village people, share it with your colleagues, share it with your neighbor. Just share it with as many people as you can to make sure that they benefited from this webinar, to make sure they have informed decision to ask the right question. I know you'll be waiting. What is that gift? What is that gift? What is that gift? What is that gift? Yes. Now, I told you that I am going to give something special to some of you that partook in this webinar. All right, if today's session opened your eyes to the truth about health insurance in Nigeria, then you are going to love my brand new ebook titled 20 Mistakes Nigerians Make When Choosing Health Insurance and How to Avoid It Like a Pro. Yes, you see those how to check or how to know the right HMO, you have to know the right thing. And many people have complained, or the majority of people that are complaining is because they made some of all these mistakes, which from my experience of working in the bedside and working in the HMO, I have been able to categorize 20 solid mistakes people make when they are buying health insurance. And it is because of these mistakes they are coming to say HMO is a scam. Ladies and gentlemen, HMO is not a scam. You are the one that did not ask the right question. It is because you were ignorant of some key secret sauce. I have shared some in this webinar. I told you, can you remember? I said your needs is a secret sauce. The hospital list is a secret sauce. You must know. You can't just buy any plan without knowing the hospital and network. What if you buy a plan and you now went there, you are seeing only one nurse on it? That is not a hospital. That is why I have packaged everything into a very compatible, very explicit, easy to understand, devoid of medical jargon for you to digest. Okay, for you to digest. Inside, you will learn about the hidden traps most agents will not tell you about HMO. You will decode the plan's fine print. What are fine prints? Fine prints are the coded information that they will hide inside the agreement. The more you look, the less you see. You will read it and you will not see anything. You will look at it and you will not decode anything. Inside this book, I also share secret questions to ask that salesperson that want to game you, that salesperson that want to trick you. I have also packaged the questions you need to ask, secret questions you need to ask before paying a single naira so that you will not have either a bad or ugly experience. All right. And because you have participated in this webinar, I am going to give you a good offer. And this offer is you have to use this smart code on your screen. Smart Health 30. Smart Health 30. Visit www.odiloalexander.com.ng. When you go there, input this code SMARTHAIR30, you get 30% off the price of the book. And please don't share this to anybody that did not watch this webinar. Don't share this to anybody that did not participate in this webinar. In this webinar, this is your free gift. Use it and you get 30% off my launch copy. And you have to do it very fast because any month from now, I am going to take it back to original price. And trust me, this book will change how you see health insurance forever. At this point, I want to say thank you very much for participating in this webinar. And I really want to appreciate you for staying this long. I really want to appreciate you for staying this far, for coming with me this far. Can you follow all my channels at Odilo Alexander? In YouTube, my channel is AO Daily. And rest assured, because you participated in this webinar, ensure that you filled your details in that link I shared under this video so that you can also get your certificate of participation, so that you can also tell people that you participated in this webinar by someone who has worked on both sides of this divide. All right, so that you can explain to your people, you can explain to your friends that you now know what it means to have health insurance. So at this point, if you have questions, do well to let me know in the comment section. Do well to let me know. Just share your thoughts and I will take them one by one. Once again, thank you very much for joining me in this webinar. These are my contact details. Feel free to reach out to me. And the only way I can answer you is you have to let me know that you were part of this webinar. And if you have any questions about health insurance and you want me to help you answer, or there's an inquiry you want me to know, there's an inquiry you want me to help you decipher, your ticket is my ebook. Once you come with your receipt, just slide in my DM and trust me, I am going to do justice. Thank you very much for your time. Thank you very much for joining me. And I want to say, have a very wonderful night rest. I remain my humble self, Odilo Alexander, and take good care of yourself. Bye. I'll answer your question. I'll answer your question. Please drop your question in the comment section. Just drop your question. Just share your thoughts, and I will take them one by one. All right? I will take them accordingly. Yes. Share your questions. And if I don't pick your questions, it's not deliberate. I will still answer it. I will take them one by one according to the order in which they were asked. All right?